The Council of Governors has called on doctors across the country to embrace dialogue and consider calling off the strike that has had devastating effects on Kenyans. This even as the Catholic Church called on the government and the striking doctors to soften their stance and allow for constructive dialogue to ease the suffering of many Kenyans. Our reporter Gabriel Kudaka has more on the strike that has now entered its 13th day.
For close to 2 weeks now, this has been the scenario in many parts of the country as striking doctors agitated for implementation of a number of issues, including payment of intern doctors. The effect so devastating, sometimes resulting in death. The Council of Governors now says enough is enough.
By now we have heard you. Not only hearing you, we have felt you. We know you are crucial. We know your issues have not been met. Lakini na nyinyi rudini kazini, because at the end of the day tukienda mgomo mpaka patients wetu waishe, we are being retrogressive with our health sector, which we have done so much.
The governor said the government was willing to address some of the issues raised by the doctors immediately, whereas others will be implemented later due to lack of sufficient funds.
We are ready as a government to cooperate, but it is not possible to do it in one day. We must have a workable solution where we must trust each other. Tukisema internship tutafanya within the month of June, ama ifanywe mwezi wa August, kwanza kulipa ndio tupitishe budget. The union should understand. Tukisema universal health coverage hatuwezi waandika na siku moja mpaka ikuwe gradual.
The Catholic Church has called on the striking doctors and the government to soften their stand for an amicable solution.
Why don't they sit down and bring this strike to an end? Because the poor are the ones suffering most, and therefore it's a very urgent situation which needs to be looked into.
Meanwhile, Nairobi Governor Johnson Sakaja has issued a one-day ultimatum for the striking doctors in Nairobi to resume duty lest they face action. Sakaja said the doctors in his county had already been paid.
You get your insurance, your salary is on time. Why are you rioting or striking because of a different employer? If you're interested in serving Nairobians, because how am I going to contract now to Nairobi kuwapatia huduma? If you're a doctor and you're interested in working in Nairobi, be in hospital. I told them that on Thursday. On Friday, I had 60% of them reporting back to work. They came back to work. Monday, nimeandika barua ya wale 40% watuambie kama wanataka kazi. Kama wataki, kuna wengi wanataka kazi ya kuwa daktari.
Gabriel Kudaka, NTV.